Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the retinal vein occlusions, now complications of retinal vein occlusions. Retinal vein occlusions can result in cystoid macular edema can occur in the patient. Cystoid macular edema can occur in retinal vein occlusions, and there can be neovascularization can occur leading to vitreous hemorrhages, and also tractional retinal detachment can occur. So there can be neovascularization which will lead to vitreous hemorrhage, and this retinal vein occlusion can also lead to tractional retinal detachment. Then as a complication, this retinal vein occlusion can also result in glaucoma because of neovascularization. Thus it is called as 100-day glaucoma. So it can also result in 100-day glaucoma because of this neovascularization. So neovascularization can result in vitreous hemorrhage, tractional retinal detachment, and this can also result in 100-day glaucoma. What is this 100-day glaucoma? 100-day glaucoma mainly occurs here the neovascularization. It is a neovascular glaucoma which occurs in the ischemic central retinal venous occlusion after 100 days of occlusion. So thus it is called as 100-day glaucoma.
thank you and thank you for watching.